Hi, my name is Chelsea Karji, and today I will be presenting on multidisciplinary collaboration in healthcare. The objectives that I put together are that by the end of this presentation, you'll be able to summarize the benefits of multidisciplinary collaboration in healthcare. You'll be able to derive why collaboration between professionals can positively impact patient outcomes, and you'll be able to explain measures that can be taken in healthcare facilities nationwide to encourage collaboration. The thesis statement that I had for my research paper is because multidisciplinary collaboration improves patient outcomes and decreases the length of hospital stays, it should be improved in healthcare facilities nationwide. The nursing theorist that I chose for my paper is Lydia E. Hall. Her theory was the care, core, cure theory. This theory addresses three different aspects of nursing and how they interconnect with each other and with members of the healthcare team. The core aspect is defined as the patient who is receiving care. The cure aspect focuses on the disease that the patient is suffering from and any medications or treatments that they're receiving. And the care aspect addresses only nurses and focuses on the care that only nurses can provide. The first study that I had was a qualitative research study conducted by Liberati, Gorley, and Scarati in 2016. The purpose of this study was to analyze boundaries that affect collaboration and care integration in newly created multidisciplinary teams. The sample for this study included 42 healthcare providers who all worked on a stroke unit in an Italian hospital. Of these 42 healthcare providers, 6 were neurologists, 8 were intensivists, 8 were surgeons, and 20 were nurses. The method of data collection that they used was 180 hours of transcribed observation and conversation with the participants. Data collection activities included participation in team meetings, medical and nursing handovers, observation of routine care practices in the stroke unit, and frequent conversations between the researcher and the nurses and doctors. This study found that disciplinary boundaries hinder care integration in the stroke unit by affecting intraprofessional collaboration among doctors, intraprofessional collaboration among nurses, and interprofessional collaboration between doctors and nurses from different disciplines. The second study that I had was a quantitative research study, and it was conducted by Green, Marzano, Ledishki, Mitchell, and Bissett in 2016. The purpose of this study was to determine tools and strategies that would allow for early mobilization of patients from the ICU. The sample that they used was 1,976 patients, all from a 31-bed ICU located in Australia. The method that they used to collect their data was a physiotherapy mobilization flowchart and various data collection tools. This study found that early progressive mobilization is safe and feasible in critically ill patients and requires the close collaboration of multidisciplinary teams on a daily basis. The third study I had was a quantitative research study conducted by Mudge and their associates in 2016. The purpose of this study was to determine if outpatient multidisciplinary collaboration had any effect on the tablet load and number of potentially unnecessary medications prescribed to elderly patients. The sample that they used for this study was 17 patients aged 70 to 95 at a Thrive clinic in Brisbane, Australia. Thrive standing for Targeting Hospitalization Risks in Vulnerable Elders. The method of data collection that they used was screening tool of older persons' prescriptions and demographic and clinical data that was collected by the clinic itself. This study found that a multidisciplinary outpatient model implemented in the early post-hospital period reduced inappropriate prescribing and medication count in older medical patients that had frequent hospital admissions. The fourth study that I had was a systematic literature review, and it was conducted by Shetman, Hansen, DePutter, Battenberg, and Baker in 2015. This study examined the effects of interdisciplinary collaboration in healthcare by studying the results of each individual study. The sample that they used were 51 studies that each tested the results of interdisciplinary collaboration in primary care in various regions. The articles that they chose to use all came from databases such as PubMed, Cochrane, Cinehall, and Embase. And they only chose articles that used quantitative data to test the outcomes of interdisciplinary collaboration. What the study found was that almost one half of the 139 outcomes were non-significant, having a p-value of less than 0.05, and the highest concentration of studies that were significant reported on the clinical outcomes of interdisciplinary collaboration. The fifth study that I had was a qualitative research study, and it was conducted by Van Dongen and his associates, and was conducted in 2016. The purpose of this study was to explore any influential factors associated with interdisciplinary collaboration and its effects on the development of treatment plans in primary care. The sample used for this study was 31 participants from a variety of healthcare professions. Of those 31 participants, 11 were men and 20 were women, with an average age of 47 years old. The data collection method was 4 focus groups. Each group met over 90-minute sessions, and the researcher in charge of each group would ask the participants about any experiences, barriers, and facilitators to the process of interprofessional collaboration on patient-centered care plan development in the primary care setting. A limitation that was found in this study was the underexposed patient perspective in the focus groups due to the patient experts adopting a more professional perspective rather than a patient perspective. Some findings from the study were that they identified many factors that affected interdisciplinary collaboration when developing care plans for patients. The sixth and final study that I had for my research paper was a process mining focused study. This study was conducted by Conca, St. Pierre, Herskovich, Sepulveda, and Capero, and was conducted in 2018. The purpose of this study was to identify patterns of collaboration between healthcare providers. The sample that they used was data collected from electronic clinical records from 3 primary healthcare facilities in Santiago, Chile. The method of data collection that they used for their study was information collected, including information related to patients, their appointments, diagnoses, and test results, each visit that the patients had to the healthcare center, the date of the visit, type of appointment, and the professional in charge of the visit. This study found that they identified 7 patterns of collaboration, which varied depending on the number of disciplines present, the participation intensity of each discipline, and the referrals between disciplines. Some results from each of these studies. Liberati et al. Found that achieving interdisciplinary work requires not only the bridging of interprofessional boundaries, but also the consideration of the dynamics of control and resistance involved in merging doctors and nurses with different disciplinary backgrounds, which can always be challenging due to the different scopes of practice, etc. Mudge et al. Found that when a multidisciplinary framework is put in place, the amount of inappropriate prescribing among patients is reduced, decreasing the incidence of adverse drug reactions. As evidenced by Marzano et al., a multidisciplinary approach to patient care can also improve patient safety, which is always a priority in healthcare settings around the world. And if collaboration takes place in teams, then the team leader can play a vital role in ensuring the organization and coordination during collaboration and can guide the team through developments, which is always a vital part in ensuring that collaboration runs smoothly and effectively. Overall, this research has demonstrated beyond a doubt that improved multidisciplinary collaboration in healthcare will improve patient outcomes. However, it has also demonstrated that there are many boundaries that must be overcome in order to achieve improved collaboration. This page has all of my references listed, and I hope that you were able to meet the learning objectives that I set at the beginning of my presentation. Thank you so much.